better, doesn't it? Um, I am excited because I am a great devotee of interprofessional education, and the things that you've been talking about that I overheard are just wonderful. And I'm coming to you with several hats on. As you noted, I am a patient on occasion, but not very much. But I am a caregiver to my husband who has the unfortunate circumstance of having late effects of polio, which is an autoimmune disease, but it is a cohort that is dying, so it's not seen as sexy. However, it does affect any other disease that he might happen to get. And I've seen firsthand how the pecking order in medicine and nursing can work its way through the way in which care is delivered. Watching how doctors talk about physiatry, for instance, or the role of physical therapy is pretty unnerving, especially to a patient who isn't sure when they're going to lose their mobility, etc. My husband used to work at the Institute of Medicine for David Hamburg. He became the vice president of Blue Cross. Before that, he had actually worked on the Hill for Senator Ted Kennedy. So we know an awful lot about health care. But he left health policy because he couldn't stand what was going on and became an Episcopal priest. And I suddenly became the minister's wife, who not only had to take care of him and live up to this role, but who actually got asked, because of the things I do in health policy, to work with people in our little community up in West Virginia, not just in our parish, but in others, many of whom are poor, pretty illiterate, don't know how to use the healthcare system, are afraid, and our doctors call it Appalachian apathy. And we could go on and on. But it's really given me an eye into seeing how not just my white middle-class friends and upper-class friends interact with the healthcare system, boomers and take charge folks, but others as well. I actually started my professional career working for IBM, working on the very earliest decision support systems and voice recognition systems. And I am appalled at how long it has taken to apply some of these technologies in healthcare. But it's coming. But with sensors and other things, there are going to be lots of ways in which patients don't need to see the doctor and will be able to give information to the doctor, but really to the team. And I think it's exciting. It's not denigrating a doctor, but it is empowering other people to be part of the team and to have the patient or their caregivers be part of that team. I'm actually a former instrument-rated pilot. I know what a good team can be. I know how hard it is to create honesty within a team. I know how hard it is to protect a culture of safety. And again, medicine and healthcare is so behind aviation. And it's kind of hard to believe. But I have to fess up. The other reason I'm here on my policy hat is my daughter, my niece, and my sister-in-law are all nurses. My daughter and my niece are getting their advanced degrees. And when my daughter in particular taught at first trained at a magnet hospital, where there was really good communication. There was really systems re-engineering going on. And then she moved, and now she's in a place where the communication isn't as good, and some of the stories that she tells me show what we shouldn't be doing anymore, but still are. So those are the things that Marla and others suggested I should talk about. In light of the discussion that I overheard, I had a whole bunch of things I'd love to talk to you all about because you know so much. I think the one thing that I think we might want to focus on in some of our comments is uneven power relationships and how changes in reimbursement and changes in the social contract already are going to affect what you all do, what your students do, and I personally believe that this social contract that you're trying to work out, a transdisciplinary professionalism, could be the saving grace. It could be a rudder that guides change. And as a patient and as a caregiver, I want a professional helping me, but I don't want to, I'm not a clinician. I don't want to be making decisions I can't make, but I do want to be part of that team. And so the question is, how do you look at transdisciplinary teams that are going to float in their function, in their power relationships from circumstance to circumstance? That is one tall order. And I'd love to talk with you.